The governor has outlined a reopening strategy, and the statewide trend for new hospitalizations is going down. That is all good news. But unfortunately, the numbers inside long-term care facilities, well, they're going in a different direction. Connecticut may have reached the peak, but not Connecticut's long-term care facilities.
Our peak in our industry will be after the hospital peak. So my guess is in a week, 10 days.
Despite best isolation practices, COVID-19 is still ramping up in nursing homes. 70%, or 150 of the state's 215 nursing homes, have at least one COVID case. The largest outbreaks are at these three: Riverside Health and Rehab in East Hartford, Abbott Terrace Health Center in Waterbury, and Litchfield Woods in Torrington. When you combine both confirmed and probable COVID-19 deaths, nursing homes account for 55% of the death toll in the state. And that doesn't include deaths in assisted living facilities. Deaths there are still not being tracked, but the infections are. Here's our first look at the most infected assisted living facilities: the Village at Buckland Court in South Windsor, the Waveney Care Center in New Canaan, and the Village at East Farms in Waterbury. In total, there are 558 confirmed COVID cases in assisted living facilities and 140 suspected cases. Why suspected and probable? Well, it all goes back to testing. The long-term care industry says they need help.
Residents who are both asymptomatic as well as those who are symptomatic, we need to be testing nursing home staff and caregivers. It needs to be accessible to any family member who would like to visit. In order to make the most use of those testing results, the results need to be available rapidly.
Testing is only one of the three pillars to getting the long-term care facilities on stable ground. Staffing and PPE are the other two. On PPE, it comes down to dollars and cents.
We're all planning for 90 days of supply. 90 days is a goal. How many times have you set a personal goal and not met it? And not meeting a 90-day supply of PPE just makes us a little bit more anxious and eager to get up the next day or not to go to sleep without pushing the purchase order button.
Masks that used to cost 6 cents now cost $1 each, and gowns that used to cost 60 cents now cost $6.
Cost us almost $45,000, 7,000 gowns. That's an obscene price.
And with staff getting sick, the industry needs help.
We need adequate staffing, and we need the financial backing, or the continued financial backing, of the state of Connecticut to assure for the staffing that we need to win this battle.
In many cases, hazard pay is being provided to eliminate the need for staff to hold down multiple jobs, risking further spread. $35 an hour for certified nurses assistants, $50 an hour for licensed practical nurses, and $70 an hour for a registered nurse. And unfortunately for families, until testing, PPE, and staffing all stabilize, industry experts tell me that they don't see visitor restrictions being relaxed anytime soon. For the Fox 61 News, I'm Matt Caron.